there are two major factors influencing the answer to this question. And one of them is the fact that there's healthcare worker shortages. It's very difficult to hire staff in healthcare setting over the past few years because of the stress associated with those roles. Stress being induced by long hours, difficult processes, a lot of manual work that perhaps the clinicians that are on staff didn't sign up for when they went to school to become a nurse to help patients. So there's that aspect of, there's the workforce shortage, that's an issue. There's also the complexity of technology in the space. So there's a lot of different point solution technology services that are meant to alleviate the stress associated with healthcare operations. All of those point solutions need to be interoperable within the healthcare setting, and they need to be secure. So those endpoints need to be tied and make sure that they don't leave the healthcare association open to things like ransomware attacks. So because of the explosion of these two factors, IT teams really need to look at addressing the complexity of the different technology solutions available to improve efficiencies. They need to make sure that all of the services they provide are provided in a way that maintain the security. And they need to also address the fact and help their healthcare operations folks address the fact that the workforce needs help in making sure that they can be as efficient as possible. In order to answer this question, the first thing to understand is, what is IT as a service? IT as a service means that the healthcare organization pushes the traditional blocking and tackling of information technology services over to Synoptek. So this means that you're looking at your number of tickets, how often they're open, how long it takes them to close, what are the trends we're seeing with the tickets that are open, which software applications continue to fail. Those are the types of things that you look at when you're running IT as a service. Now, if you're working with a company that does that all the time, what that company will do is leverage what they understand of network infrastructure and security and workflow efficiency and process to recommend the ways of running your IT environment in order to be most efficient and effective. What this helps healthcare organizations do is focus on patient care rather than investing in additional IT talent to stay abreast of all the newer technologies and services out there. And that helps healthcare organizations stay focused on the patient while running a best-in-class IT. Synoptek's IT as a service is a cost-effective tool for healthcare because the budget is fixed. So based on the number of sites and users and networks we manage, there's a fixed cost associated with that. And then the addition of offices or clinics or end users is a fixed price. So this gives our customers a way to manage their budgets over time, understand when they're going to grow, what is the impact of that growth on their IT budget in advance, and there are no surprises. The other thing that we offer is an operational expenditure as opposed to capital expenditure on managing IT services. And the third thing I would say is that our IT services offer fractional resources and shared services. So you don't need to pay for your chief security officer full time, 24/7, 365. You pay for that security officer the number of hours that you need that service. Beyond the obvious of setting up a compliant environment that follows NIST and HIPAA guidelines, we really focus on managing the endpoint security. So all of the different users that have access to your network, ensuring that they understand what it means to maintain a secure environment, what phishing expeditions from ransomware attackers look like, so that they don't inadvertently allow somebody into your network that could cause a breach. Oh, sure, because these facts I'm really proud of. We have one specific healthcare customer runs over 90 clinics where we reduced costs by almost 20%, migrating to our shared service and fractional resources and, overall IT as a service model. We had better performance, meaning that the number of tickets have decreased and the time to close them out has gone down over time with this customer. Their user experience surveys have provided feedback to show that they're more satisfied with their IT environment using our 24/7, 365 end user support. So that means that if there's ever a problem with your system, you can call and get a live voice on the other end of the phone to help you through fixing that issue. The networks associated with this customer have an uptime of 99.9%. It's really important in healthcare that you don't have a my EHR provider has upgraded their network, and because of that, software as a service, it didn't transfer. It no longer feeds into my network in the way that it used to, so I can't use my EHR platform today. If all of that isn't mapped out with your service providers and understood in advance, then you will have downtime in your office, and that's not something that will lead to quality patient care. So we help address that type of thing with our services. We also make sure that we have data backup and recovery, and that helped this customer make sure that they never lost data on any sort of patient transaction that they needed. Well, Synoptek will continue to improve workflow efficiencies. We already have customers that we work with for beyond the traditional IT services with back office support, like automating invoice generation for revenue cycle management and implementing ERPs in such a way that there's automated workflow management through approval processes. We also help customers with front office support, like integrating telecom services with the electronic health record platforms in order to reduce swivel chair time for the front office staff, so they don't have to log out of one environment, log into another. The two talk to each other, and so we will continue to do that. And we'll also leverage AI for virtual agents in that space so that we can automate patients needing to reschedule their appointments through their EHR platform. So all that requires is making sure that however the patients communicate with the office, text or phone, they can be automatically taken care of through a virtual agent integrated with the EHR. And we'll continue to stay abreast of security. Just this week, NIST released an update on their recommendation for password resets and the time in which you do them. And instead of resetting passwords every 90 days, they've recommended that you remove that requirement on your end users, because it makes end users use passwords they can easily remember and that are easily phishable. So that's how we will continue to serve our customers. Well, Well, the number one reason to choose Synoptek for healthcare managed services is because our model that we have delivered on over the past 20 years has demonstrated time and time again to reduce operational costs of IT. So I shared the case study earlier of the 20% cost savings. That's the number one reason I would say healthcare companies should come to Synoptek to evaluate how we can help them save costs. But even more important than that is the feedback I have from our healthcare customers on the services we provide. So I have a customer that sees oncology patients out of the Los Angeles area, and they shared with me a couple weeks ago that they're very thankful for their engineer on site who will always figure out if a software that they're using to manage patient care is not working, that engineer can quickly decipher if it is a network issue or an issue with the software coming from the software vendor. So the reason why that's so important is because that knowing if you need to, raise an urgent alarm with the vendor because they have changed something on their end that makes their software no longer configurable with your environment, and then having a technical person on our side speak with the technical people on their side to resolve that quickly is very important. And that's why customers come to Synoptek, because we have the technical know-how in the IT environment to make that happen.